Hey, Max. How you doing? Hey, everybody. I'd like to introduce you to Max. Max is our mascot for our Maxolotl program. And Max is an axolotl. Axolotls are really a remarkable little salamander that live in Mexico. And they have an incredible regenerative capacity. Now, these poor fellas, they can have a leg cut off. They'll regrow the leg. You can remove part of the brain will repair. You can remove parts and pieces of the what looks like an adult maxolotl, and it will repair. They're very inspiring, and they have taught us a huge amount about regenerative medicine. We need to be very thankful to these little partners for helping us understand regeneration. So in honor of the axolotl, Max the Maxolotl will be with me today as I'm telling you some more information about this really remarkable process. So Maxolotl is the name of a therapy that uses autologous stem cells to repair tissue one person at a time. Now, what is an autologous cell? An autologous cell is one that came from you. Most of the time when you hear about stem cell therapy, it's not autologous, it is allogeneic, which means it came from somebody else. And when you repair tissue, you want to use original manufacturer's replacement parts. Well, Maxolotl is ideal for those individuals who have suffered injury that is not been repaired by the usual injury repair processes. Especially the older an individual is, the fewer autologous stem cells that live in that person's body. So remember, autologous comes that is from self. And when we run out of those stem cells, we scar instead of repair. And so individuals who are suffering from neurodegenerative disease, from cardiac damage, from nerve damage, lung damage, skin damage, muscle degeneration. The list really goes on when we're starting to think about what are the tissues that we're able to repair. A very important one is degenerative joint disease and osteoarthritis or degeneration of the joints. All of those have the potential for very substantial repair. Well, Maxolotl is very different from other regenerative therapies. Now, whenever somebody says stem cells can be either autologous or allogeneic. Autologous means it comes from you. That means your cells are harvested and they are used in your healing process. Allogeneic means it's somebody else's cells, and those usually come from placentas or from umbilical cords, and those are harvested, grown, and can be infused, and they can be really helpful for decreasing inflammation or maybe even bolstering your own body's ability to heal, but they're still somebody else's tissue. And repeated administration of those can irritate the immune system, and there are concerns about autoimmune disease in that arena. However, when you're looking at autologous, using your own cells, especially in the Maxolotl process, these cells are nurtured down a particular differentiation path. That means they are going to, if they're designed to become cartilage and connective tissue, they will go that direction. If they're designed to become nerve, they will go down that direction. They're not able to go every direction. They're pre-programmed to heal the tissue that is the target of healing. The inventors of this process, in conjunction with treating our patients, were really quite astounded at how much better our patients did than patients they had treated in the past. And the founder is also very aware of plasma exchange. And when he recognized that we were already treating our patients with hope, habitat optimizing plasma exchange before they would have cellular therapies completed. He said, well, that makes all the sense in the world, because HOPE is able to help the stem cells that live in the body to shift their behavior to a younger state. So meaning that they're more vibrant, more able to do the job of division. They are healthier to begin with. So we take a lot of care before harvesting stem cells to make the body as healthy as possible, so the cells that we harvest that will then be grown and multiplied and used for the repair process can do the best job possible. Also, habitat optimizing plasma exchange is very helpful to calm down the inflammatory and autoimmune burden that many patients have before cells are administered, which again decrease the noise of inflammation in the body so that healing can be very directed. So these cells go to the grow in the right places in the right ways with maximum beneficial effect. So we're actually looking at two different types of cells in the Maxolotl process. We harvest adipose-derived mesenchymal stem cells. So that is done through a micro-liposuction technique. We only have to harvest about a teaspoon or two of fat. It's a small surgical procedure that is done in the office under local anesthetic. Very safe. And then the other process is we actually harvest your white blood cells. That's a process called leukapheresis. And leukapheresis is done with the same machines that we use to do plasma exchange. And this ability to harvest the white cells is a real unique capability that we have here at MaxWell Clinic, and why we're a preferred partner in this process. So we're harvesting two different types of cells, two different ways. It makes us very efficient. To know if you're a good candidate for Maxolotl, you need to know, number one, do you have damage that you would benefit by it being repaired? Remember, aging is really the accumulation of damage. The older we are, the more organ reserve we lose. And we tend to just get used to things with regard to our damage. Like if we have arthritis or bone on bone, our cartilage is broken down, or we're having slight cognitive decline or less cardiac output, we kind of get used to that. And our paradigm, this is going to require entire rethinking, because up until now, we've just tried to do the best with what we have. We've never thought we could have more. So first of all, you have to recognize you have damage that would benefit from repair. And then second of all, you should talk to one of our clinicians that understands this process and can talk about what would it be, how would it be beneficial in your specific case. Well, during your initial consultation, we will have already gathered some very important information about the types of diseases and injuries and challenges that you have. And we're going to talk about those. And we're going to also understand, how are your current medical conditions being managed? Are you addressing the underlying causes of progressive damage? We're going to discuss carefully this process and how it would be applied to you. We're going to answer all of your questions about how long does this take, what is the process like, all the things that are specific to your particular case will happen in the consultation. Yeah, so part 2 of the protocol is administered in Buenos Aires, Argentina, with a group that is really at the very forefront of cellular medicine in the world. They're able to do this because they have very effective regulations in Argentina for the safe administration and management of cellular therapies. When you're in Argentina, the expectation you should have is that for your first trip may last about a week. It really depends upon exactly the therapies that will need to be applied and exactly what specialists will be involved in your care while you are there. Because when we think about cellular medicine, it's on one hand, we really need the expert that knows how to shape and guide the cells to become what we desire those cells to become. But we also need a team of specialists that can help administer those cells and to do the studies before and after the administration of the cells to show that they're working as intended. It's a wonderful team that exists in Buenos Aires, and the stay can be as long as a week, but that's usually for the first trip. This therapy has to be done repeatedly over the course, at least over the first year. It's recommended, and this is where everything is unique, but in the most frequent an individual would need to be down there is every 6 weeks for the first, say, 3.5 months. After that time, it can get stretched out to every 3 months, and usually the therapies are mostly completed by the time a year has elapsed. However, aging doesn't stop, degeneration doesn't stop, and so it may also require repeated visits and down to Buenos Aires to stay at the top of your tissue health game. When we're looking for a time scale of results from the Maxolotl process, it's important to think about, well, where am I starting from? And at what point will I have functional changes? This is a cellular therapy. Cells make up tissues. Tissues make up organs. Organs together work together to make the function of the body. So there's a lot of growth that has to happen. Now, the fundamental growth is incredibly stable and healthy, and there's a lot of compounded effects of the healing that take place. But as soon as people start to feel therapies, would probably be as early as 6 weeks in terms of conditions that are treating nerves. Some individuals that are having brain treated have effects really within the first week. But many of these other therapies take many months to see changes. So for instance, one of our 80-year-old patient that had no cartilage in his right knee has regrown the entire cartilage in the right knee. And really within the course of about 6 weeks, his pain had gone down almost 80%. But it still took many more months for that cartilage to continue to grow, mature, harden, so that he has full function. And we're still working towards more physical activity. Because what's interesting, once you fix one thing, now you become aware of some other injuries that you have just not been noticing because your primary problem is now better. And so, that's why a comprehensive approach is very important in this entire process. These results are as permanent as any healing in the body, which is really, I would say, permanent. It's really incredible. This is regrowing tissue. And so if you don't exercise your muscles will degenerate and go away. The same way with this. If you don't use those cells, like every tissue in the body, they could shrink and go away. But more than any other therapy I can think of, the more you do this therapy, the less you need this therapy. And that's really the mark of a healing therapy. Well, how you get started is a consultation. Give us a call at MaxWell Clinic. Click the button below. Whatever you need to do to give us a call. This is highly personalized medicine. This is not, you know, this is not assembly line medicine. You have to be looked after as an individual throughout this entire process, from the preparation to the treatment to the follow-up and the activation of those cells. So it has to start with a personal consultation.